So we're trying to look at a diagnostic test which is used for celiac disease. So just before I forget, this test is known as what? The immunoglobulin A anti-tissue transglutaminase test. So you get to see why the anti-tissue transglutaminase is the one that is basically being measured for, right? It's a test which is used to what? Diagnose celiac disease. So this one, we said that the immunoglobulin A anti-tissue transglutaminase antibodies, they're actually a blood test which is used to help diagnose celiac disease. Now, you should know that celiac disease is an autoimmune condition. When you say something is autoimmune, it's like your immune system is on the automatic side. You get like your immune system is like attacking the body's own cell, right? So celiac disease is an autoimmune disorder which is usually triggered by gluten. Okay, so by dictating the antibodies that target an enzyme in the intestine called the tissue trans antiglutaminase. Now, for the hemoglobin A anti-tissue transglutaminase, you are trying to now measure the antibodies. You are trying to also see if there is any antibodies at all developed against the what? The tissue transglutaminase. You get? So what is it? It actually measures the levels of what? Hemoglobin A antibodies that are developed against what? Tissue transglutaminase. And they will only be developed against the tissue transglutaminase only if you have celiac disease. You get? So celiac disease is an autoimmune condition. I've already spoken about it. So it mostly triggered when you have it's mostly triggered when you have eaten gluten. The measurement of antibodies against the tissue transglutaminase and deaminated with gliadin peptide. So immunoglobulin A anti-tissue transglutaminase can be used for monitoring dietary adherence in addition to diagnostic value. So endoscopic biopsies can also be done. They're actually the gold standard. You understand? So they can now you can now be able to see that okay, the body's immune system is attacking the intestines to the level that you have what villus atrophy. You get? So I think this is just basically that, and this is celiac disease. So in celiac disease, the villi should be okay, like in healthy intestine, the villi should be normal, tall, ready for absorption. But in celiac disease, your villi are kind of like be cutting off. So as they are cutting off, you're also having difficulties in what absorbing nutrients. Right? That's it for the test to diagnose celiac disease.